So let's look at the aged care crisis. Again, 12 of the 15 deaths recorded in the past 24 hours were in aged care centres. In fact, of the 162 deaths in Victoria, 137 or 85% have been in aged care facilities. Nationally, nearly 70% of all deaths have occurred in aged care homes. This is important information. It must inform our strategy. Today, one victim was in their 30s. We don't know details about medical history and the like, but we do know that fewer than 10 people under 60 years of age have died in Australia. This is a disease that is overwhelmingly dangerous to the elderly. 90% of deaths in Australia have been people over 70. It's just a fact that it is much less dangerous the younger you are. We should be grateful for this. Think of the Spanish flu taking out millions of children and young people. But it's important because it should help us protect those who are most vulnerable, people in aged care homes or the elderly in their own homes. The trouble is, as the experts emphasise, and this is really just common sense, the more rampant the virus is in the community, the harder it is to protect the vulnerable or aged care homes, any particular facility. Anyway, we need to continue the debate, the path forward, especially, as we keep saying, because there is every chance that there will be no effective vaccine, or if it happens, it might be years off. So we have to think about how to live with the virus. Victoria, of course, should be like the rest of the country by now. It should be living with some COVID-19 restrictions and chasing down outbreaks here and there. The reason it isn't is because of a series of government failures. That's why the Andrews government is in the frame. Let's list those mistakes by the Andrews government. Perhaps worst was how they allowed international quarantine hotels to spread the disease rather than contain it. They also lowered testing levels more than other states after the first lockdown. Their contact tracing was not as thorough as other states. They haven't told people as much about outbreaks as the other states have, warning them off particular locations. Clearly, they failed to protect aged care facilities, with some workers going from one centre to another. And incredibly, until just yesterday, they allowed infected patients to leave home for exercise. Infected patients could leave their home and wander the streets for exercise. And as we know, they initially also resisted Defence Force assistance that they are now getting. This is a shocking litany of errors. Victorians are paying a high price for these failures. And now Queensland is overreacting, banning all travellers from New South Wales. And New South Wales, in turn, now is demanding all Victorian arrivals go straight into quarantine. Whether you agree that Daniel Andrews' curfew and lockdowns now are too hard or not, we all know the situation in Victoria needs to be brought under control somehow. And we haven't even started to talk about how we'll live with this disease, how many infections we think we can tolerate, and how we can try to minimise the deaths and the social calamity.